The following feature presentation contains educational material dedicated to trained and clinical staff at Optimus Healthcare.
How to do a urine dipstick using the Clinitech analyzer. Supplies needed: paper towel, gloves, an alcohol pad, a black Sharpie, the container of urine dipsticks, and the patient's specimen. Procedure. To start, make sure you have your gloves on while handling the specimen. If the Clinitech machine is off, please power it on. The power button is located on the bottom right-hand side. It'll take a few seconds to warm up. The machine goes through a self-calibration step. If the machine is on, take your patient urine specimen and ensure that you have written the two patient identifiers, patient's name and date of birth. Remove a strip from the container at the time of use and not prior. Please recap the container of test strips immediately. The dipstick, as you can see, is flexible, so you are going to place it into the specimen, ensuring that you're covering all the boxes. Prior to placing the strip on the machine, remove excess urine by blotting the strip on a paper towel, drying the underside of the strip. You can also place the strip on its side for additional removal of excess urine. Place the test strip on the machine, making sure that it fits properly. If not placed properly, the machine will eject the cassette. Adjust the strip and try it again. You can go ahead and press the strip test pad. You have the option of entering the operator ID. If you do, you can put your name and title. Select enter. You can hit the enter new patient. Select enter. Patient ID as well, and then you hit start. The machine does a countdown, it'll do a self-calibration, and it'll read the test in approximately 30 seconds. The Clinitech machine will analyze the test. It takes approximately 30 seconds. In the meantime, make sure that you recap the specimen just in case you accidentally tip it over, you don't end up with a mess. You have the option of selecting the color of the urine. If it's yellow and clear, you hit yellow and clear. There is another other option. You can select that and it'll say if the urine is orange, you select orange. You keep hitting next to describe the urine. Other than that, you can go back, hit yellow and clear, and it'll start the process. The analyzer will complete the analysis and the cassette will be ejected, and the printout with the test results will print. Okay, the test is done. You can go ahead and remove the strip. Take your alcohol pad while the result is printing. Clean the area. Wait for the result. You have your printout. The result screen will display the date, time, operator name, patient name, test sequence number, along with the test results. If any results are abnormal, an asterisk, if this feature was selected, will appear next to them. Press Done. Before discarding the specimen, place it in the sink, as the provider may ask for specimen to be sent to the lab for further testing. If no further testing is required, discard the specimen in the sink and flush it with running water. Use your Sharpie. Wipe out the name and date of birth, or you can just remove the tape and you can discard the cup into the garbage along with all your other used equipment. Make sure that you leave the area clean for the next staff member to come and do their testing. Remove your gloves and wash your hands. You are now ready to put the results on the computer in the patient's record. Take your printout and go to the computer. Record the results according to Optimus Healthcare protocols. Steps for cleaning the Clinitech status machine. Gather your supplies. You will need gloves, 70% isopropyl rubbing alcohol, a container, cotton tip applicators,
paper towels,
and easy kill wipes. The Clinitech Status machine is cleaned on a weekly basis. To start, put your gloves on. Pour approximately 4 inches of alcohol into the container. Recap the alcohol bottle. Remove the tray. You will have 2 pieces. The area where your test strip is placed, along with the bottom tray where that smaller tray rests on. Please make sure when placing the trays in the solution, you do not let the white bars on either piece touch the alcohol solution. Both pieces need to be above the alcohol level. You can leave the trays in the solution for a minimum of 2 minutes, maximum 10. You will need a timer or a watch. After the 2 minutes, take the container with the trays to the sink, remove both pieces, and rinse the trays under running water, avoiding contact with the white bars. You can now discard the alcohol. Place both pieces on the paper towels, and you can tap the trays on the paper towels to remove excess water. If you notice, the large tray has many grooves where water can accumulate. Extra tapping may be required. You can go ahead and use paper towels to dry other areas, avoiding the white strips. If you notice that the white tab is visibly soiled, please take a cotton tip applicator, wet it under running water, and squeeze the excess water. Gently slide the swab back and forth until the stain is removed. If not soiled, then there is no need to clean the white strip. Let it air dry. Once the equipment is completely dry, place the small tray into the larger one and place both back into the machine by pushing gently. Expect some resistance. Continue inserting the tray halfway. You are now done cleaning the trays. Please avoid scratching the white tab. If accidentally scratched, the unit will not work and the tray must be replaced with a new one. Now the machine itself has to be cleaned by wiping it down with the Easy Kill wipes. Please note, these wipes contain chemicals which can affect the skin, so please wear gloves at all times. The cleaning of the machine is done on a weekly basis. If visibly soiled, it can be cleaned at that time as well. Clean up your area, place the alcohol in the cabinet, and discard used supplies. Remove your gloves, and as always, wash your hands after every procedure. The final step is to log that the actual cleaning was done on the log sheet found in your department's calibration logbook. Find the Clinitech Status Analyzer log sheet. Write the location on the top right-hand corner if it hasn't already been done. Write the month and the year on the area provided. Depending on the week you are on, write the date. Place a check mark on the disinfected and inspected section, as well as placing your initials on the areas provided.